The World Health Organization is constantly reviewing the science in many fields to help answer questions and provide guidance to government health agencies and the public around the world. One of the reviews that has been planned and is currently being undertaken is a comprehensive health risk assessment of radio-frequency electromagnetic fields. These are the electromagnetic waves emitted by mobile phones, television signals, and other wireless technologies. This is not the first review of the science in this field, as many reviews have already been published with similar conclusions. What makes the WHO review different will be the size and scale of it. To undertake this process, the WHO commissioned a series of systematic reviews of evidence from human and animal studies of critical health effects such as cancer, reproduction, and cognitive function. Systematic reviews are comprehensive and rigorous evaluations of the available science in a given area. But what is a systematic review? Unlike traditional reviews, which summarize expert opinions, often referred to as narrative reviews, systematic reviews follow a very structured and transparent approach. They collect and analyze all available scientific evidence related to a specific research question, ensuring consistency and reproducibility. The process begins with a published protocol outlining the research question, the criteria that will be used to include a study, also known as the inclusion criteria, and the methods used to assess the quality of the studies. Publishing this ensures that the process is known in advance and can be independently reproduced by other scientists if they wanted to. A systematic review may initially identify hundreds if not thousands of studies that may be relevant, but this is usually narrowed down significantly once the inclusion criteria are applied. If there are enough studies for a given endpoint, the resulting data from the individual studies may be combined in a meta-analysis, a way to combine individual groups of data using statistical methods to provide a more informed conclusion. But how are the questions or topics to be covered decided? To prioritize review topics, the WHO surveyed over 300 international experts, receiving 164 responses. This process identified the most pressing questions regarding RF-EMF exposure. And who undertakes these reviews? The WHO issued 2 open calls for researchers to conduct the reviews, selecting 85 scientists across 9 teams based on expertise, methodological rigor, and conflict of interest assessments. And what will all these reviews be used for? Each of the systematic reviews are published in the journal called Environment International, and the results will all contribute to the WHO's health risk assessment of RF-EMF. The overall assessment will be published in the WHO Environmental Health Criteria series, shaping global understanding and guidance on RF-EMF exposure. This can be a critical resource for policymakers and public health experts worldwide. Through this initiative, the WHO aims to provide an objective, science-based evaluation of RF-EMF exposure, helping to shape future health guidelines.